Welcome to DigiNerve. In this module, we will discuss about recent NEET SS recalls, that is NEET SS recalls from 2025. A 60-year-old male with a history of chronic liver disease presents with progressive jaundice, weight loss, right upper quadrant pain over past 6 months. Imaging reveals a mass in the hilar region and biopsy confirms that it is a cholangiocarcinoma. The oncology team is reviewing his medical history, which includes recurrent cholangitis, a prior choledochal cyst resection and primary sclerosing cholangitis. Okay, when the oncology team has reviewed the medical history, they find that the patient had recurrent cholangitis, the patient had prior choledochal cyst resection and the patient has history of primary sclerosing cholangitis. They are assessing additional risk factors to determine the etiology of cholangiocarcinoma. Which of the following conditions is least likely to be recognized risk factor for development of the cholangiocarcinoma in this patient? Okay, if you read the question carefully, they are asking you which of the following condition least likely to be a recognized risk factor for development of cholangiocarcinoma. What are the options? Portal biliopathy, recurrent pyogenic cholangitis, choledochal cyst and PSC. Out of these 4 options, you have to choose an option which is least likely to be a risk factor for cholangiocarcinoma developing in this patient. So what is the right answer? The right answer is portal biliopathy, and let us see why. Portal biliopathy is characterized by biliary abnormalities due to portal vein thrombosis or cavernomatous transformation, and it is not an established independent risk factor for cholangiocarcinoma. Okay, portal biliopathy can cause biliary obstruction, but it is not associated with malignancy like PSC or choledochal cyst. The patients with cholangiocarcinoma are more likely to have primary sclerosing cholangitis or recurrent pyogenic cholangitis or prior history of choledochal cyst surgery. Okay, so let us discuss again. Portal biliopathy as a risk for cholangiocarcinoma, minimal risk. Okay, there is weak association. Recurrent pyogenic cholangitis, choledochal cyst and primary sclerosing cholangitis have strong association with cholangiocarcinoma. Let us discuss about the other options. Option B, recurrent pyogenic cholangitis. This option is incorrect as this chronic inflammatory condition, which is common in East Asia, significantly increases cholangiocarcinoma risk due to recurrent infections and bile stasis. The C option, that is choledochal cyst, this option also is incorrect because congenital biliary dilatations are a well-defined risk factors for developing cholangiocarcinoma. These patients carry 10 to 15% lifetime risk of malignant transformation unless they undergo excision of the choledochal cyst. Patients who have primary cholangitis are also coming to the last option, that is primary sclerosing cholangitis. It is also incorrect option as PSC is a major risk factor and the patients who are having PSC are 20 to 30%. Coming to the last option, that is primary sclerosing cholangitis. This option is also incorrect because PSC is a major risk factor for cholangiocarcinoma. Up to 20 to 30% of the patient developed cholangiocarcinoma due to chronic inflammation and bile duct injury.